you know, making sure that we understand how to deal with our veterans. There are different type of veteran assistances, so we definitely want to understand each one of them and know what to do in each situation. So let's get started here. All right. First and foremost, let's talk a little bit and differentiate them. I want to make sure that we understand what type of veteran each of these terms represent. The first one is going to be our regular VA. This is the one that we see the most. So VA benefits or VA healthcare, these are individuals who served in the military. They do have to be honorably discharged. So there are some requirements and regulations, but for the most part, everyone that served in the military has access to a level of VA healthcare. So most veterans must enroll into VA health benefits. They don't automatically receive it. And joining a Medicare drug plan is voluntary. So that means that they can join an extra Medicare plan that includes or does not include prescriptions, because this VA healthcare benefits do allow for the member to, or the veteran to have prescription benefits. However, the prescriptions are going to be a limited formulary. They are mainly generic medications, and the prescriptions must be filled at the VA pharmacy. So this is why most of the time, like I mentioned, this is what you're going to encounter. VA healthcare, VA benefits, and that's it. They're a little bit more limited, and more so when it comes to medications. Like I mentioned, they're going to be generic medications, and they are going to be filled only at the VA pharmacy. And before I continue, I do want to let you know that on your menu, you do have a Q&A section. So if you have questions, please make sure to type them in there. I'll make sure to check periodically and stop so that we can address any questions that you may have. Second one here is CHAMP VA. So CHAMP VA is going to be for spouses, widows, and children of certain veterans. So we don't see this one as much as VA or TRICARE, which I'm going to talk about next. CHAMP VA is a health benefit program in which the VA shares the cost of healthcare and services and supplies with the spouse, widower, and children of certain veterans. So with CHAMP VA, the prospect or the person is required to have Medicare Part A and Part B, and also they may join a Medicare Advantage plan or a prescription drug plan if they want to. It is voluntary. However, CHAMP VA does provide them prescription benefits, and with CHAMP VA, beneficiaries may fill their prescriptions at retail pharmacies. So they're not as restricted as our VA healthcare benefits. As I just mentioned, these individuals, CHAMP VA, they can go to retail stores like CVS and Walmart and fill their prescriptions. Our third one here is going to be TRICARE. And TRICARE is the highest level of healthcare benefits that you can get with the VA. So you've got individuals who served in the military at least 20 years. So these individuals, most of the time, retired from the military. So they didn't really have a civilian job. They just kind of stayed with the military and got different jobs there. And so they served at least 20 years in the military, and they earned TRICARE for life. TRICARE for life is sometimes referred as military Medicare, very similar to Medicare. I like to think of it as a Medicare supplement. Basically, Medicare covers the 80%, I'm sorry, and TRICARE acts more as a supplement and pays for that 20% for that member to have virtually no costs or cost shares. So with TRICARE, the member must have Medicare Part A and Part B. They are able to go inside of the VA facilities for care, or there is a TRICARE network outside of the VA facilities as well. And prescriptions may be received either inside of the VA or outside at military treatment facilities, or through TRICARE mail order, TRICARE retail network stores, or at any non-network pharmacy. So a little bit of less restrictions. So you can see, as we traveled from left to right, we became a little bit more, we saw a little bit more and more freedom in the type of healthcare benefits that these individuals have. Now, this chart right here, I got it directly from cms.gov. So I am going to share the link in a follow-up email. I want to make sure that you all have the latest information. And I know it's so much information. I want to make sure that you have it to reference in the future as well. I'm going to stop right there. And I'm going to see if there's any questions because I know that was a lot of information. Sarah, yes, you are muted. So again, don't forget, you have the Q&A. You can definitely type in your question there at the end of the presentation. If time allows, I will also, if you want to unmute yourself and ask a question, you will be more than free to do so. Going on to the next slide here. So let's dig in. Now that we identified what type of veteran benefits there are, let's dig a little bit more into VA benefits. And I will tell you that during this presentation, I am going to solely, I'm going to go more in depth into VA, the first one, and the last one, TRICARE for Life. I'm not going to mention CHAMP VA as much. That one, we don't see it as much. So I'm going to go ahead and concentrate on VA benefits and TRICARE. If you have any questions about CHAMP VA, we can get together later to discuss. All right, so let's dig into VA benefits and Medicare Advantage. So what type of plan is more suitable for an individual that has VA benefits? To be honest, the answer depends on the situation of the person. So an MA-only plan with VA benefits works very well. And this is for a type of beneficiary who mainly takes generic medications and that they are easily billed at the VA facility. So if the person, they don't have as many medications, they are just getting their maintenance drugs, then it's perfectly okay for them to get an MA-only plan and not have a prescription benefit in their Medicare Advantage plan. So an MA-only plan example will be our Cigna Coverage Plan. And our Cigna Coverage Plan, as a reminder, does give back to the member $125 every single month to help pay for their Part B premium. So again, the individual who it does not take as many medications, they are mainly on generic maintenance medications, they are very well fitted to an MA-only plan. It has lower copays medically wise, higher incentives, and does not include the prescriptions. And they don't need it because they get their prescriptions filled at the VA. Perfectly fine. Secondly, if that VA wants to go, if that veteran wants to go with an MAPD plan, they can definitely do so as well. So the MAPD will give them a more varied and rich formulary than what is offered through the VA formulary. So if their reasoning, if you're going through their suitability analysis, and if you joined us last week, we talked a little bit about our sales presentation and checking their medications if they allow you to. And if you see that those medications are very complex and they have compound medications and they have medications that are very expensive or brand, then you probably want to consider an MAPD because the MAPD plan does have a more varied formulary than the VA formulary has. So another convenience for them is that they don't only go to the VA in order to get their medications, they can go to the MAPD network of pharmacies. And lastly, we do have our Cigna Preferred Savings Plan that does include the medical and the prescriptions, and it'll give the member back $125 every month to pay for their Part B premium. Apart from this, we also have our preferred plan. So I didn't add it in here because I didn't want to make it too confusing, but a VA person, a veteran, can join our preferred plan too. Most of the time they won't because they'd rather get their Part B premium back, the $125, but if they want lower copays, there is lower copays in our preferred plan, so that's also a possibility. So again, what plan is more suitable? Well, we kind of have to go back to last week's presentation and talk a little bit more about that person, their suitability analysis, to really find out what is best for them. But these individuals with VA benefits definitely have options. And I see a question. No, okay, no questions yet. I'm going to move on to the next slide. All right, so keeping in the topic of VA benefits and Medicare Advantage, reasons why a veteran with VA benefits would like to join a Medicare plan. Reason number one, zero premium options. As I mentioned, we have our Cigna Coverage Plan and our Preferred Savings. Both have a zero premium. Both give back $125 a month. So instead of even paying for the plan, they receive back $125 to help pay for their Part B premium. And so that's a really good reason, obviously. Reason number 2, no overlap with MA and VA. I always call it the best of both worlds, right? They can use the VA when it's best suited. They can use the MA benefits when it's best suited. So best of both worlds. The VA system and Medicare have no overlap in benefits. To get VA benefits, you must use the VA facilities. And to get your MA benefits, then you use your Medicare Advantage member ID card, right? Not together. And we'll talk a little bit more about that in the next slide. VA coverage changes. So health coverage with the VA varies from person to person and can change based on trends in federal funding or changes in VA group. So benefits may change. Apart from this, depending on how many years they served and other circumstances, the VA does have different levels of health care. So it just depends on the person. You know, VA coverage changes and varies is reason number 3. Reason number 4, drug coverage. A Medicare Advantage plan could cover a specific drug needed that is not covered by the VA. Like I mentioned in the previous slide, VA benefits formulary is going to be a smaller formulary. It is going to contain mostly generic medications. And so the Medicare Advantage plan may contain more medications than that VA formulary. So these are our 4 reasons. VA benefits and Medicare Advantage payment process. So if you have your veteran and he is wondering, I have Medicare and veteran benefits, who pays for what? Well, the answer is they have to pick one. Best of both worlds, remember? All right, so it's either or. They do not work in conjunction. They either show the VA card or they show the MA card, not together. Neither one of them becomes primary or secondary. So if they are using their MA plan benefits, only use the MA member ID card. And if they are going to a VA facility, then use the VA member card. Simple. Also, if the VA gave them a voucher to get a surgery done at a certain hospital, well, of course, they're going to use the VA card because the VA is providing them that voucher and that benefit to get that surgery done. So again, not together, always apart, best of both worlds whenever it's most convenient. I'm going to stop right there and see if there's any questions. So even if a member with, Marco, thank you for your question. Even if a member with TRICARE would benefit from an Advantage plan with RX coverage without any complications to their TRICARE coverage, you're getting a little bit ahead, Marco, but right now we are talking about VA benefits. In the next few slides, I'm going to talk about TRICARE and really dive into that one. So I will answer your question. Bear with me a few minutes, okay? And same, Albert, I know you have a question about TRICARE. In a few slides, we'll get into TRICARE. All right, so continuing on here. Oh, actually, it's the next one. So great segue. Thank you, Marco. Thank you, Albert. TRICARE for Life and Medicare Advantage. So why would a TRICARE for Life member choose to enroll in a Medicare Advantage plan? Enrolling in a Medicare Advantage plan provides supplemental benefits. So dental, vision, acupuncture, chiropractic care, transportation, OTC, coordinated care, and health incentives such as the $100 that they receive for completing their preventive exams. So these are add-ons that a Medicare Advantage plan would give a person that has TRICARE for Life. So what plan is most suitable for a person with TRICARE for Life? So remember with VA benefits in a few slides ago, I talked about, it depends on the person. For TRICARE for Life, it is it's a lot more simple. It's actually going to be an MA only plan. So MA only plans work best with TRICARE for Life due to the robust drug coverage members receive as part of the TRICARE for Life program. So TRICARE for Life already provides the member with prescriptions. and it's not the generic prescriptions. It's a big formulary. They do also have a network of pharmacies outside of the VA. So an MA plan would be what is best for them in this situation. An MAPD plan, something that includes prescriptions like the preferred savings plan, is not going to be a great option for an individual with TRICARE for life. If enrolled in an MAPD plan, members would no longer be able to take advantage of their TRICARE prescription drug coverage. So I'm going to let that sink in and check if there are any questions. Okay, so I think I did answer your question, Marco, but if there is anything that was left out or that you need me to explain again, please let me know. So again, TRICARE for Life, it's gonna be MA only because they already have a network outside of the VA. If it's VA benefits, then they have options. They can either go MA only or MAPD, depending on the situation of the prospect. Okay, so TRICARE for Life and payment process. When a TRICARE for Life member joins a Medicare Advantage plan, the MA plan becomes primary payer, okay? So the provider is going to bill the Medicare Advantage plan first. So step number 2, just like I mentioned, provider files the claim for services with an MA plan. The plan will pay for the cost minus the copay. So, you know, with our, for example, the Courage plan, there are some copays. They go to the hospital, they have to pay $350, right? So the plan will pay for the hospital services minus the $350. The provider can then turn around and bill TRICARE for Life for those $350. Now, I will tell you that most providers know how to do this and will do this, so the member will not have to pay anything. However, if we run into a situation where the member paid, there is also a way for the member to file their claim for reimbursement for those $350 copay. So that's the way that it would work here with TRICARE for Life. Let me check the time real quick. Okay, we're in good time. Comparison guide. So this is a little comparison guide that we do have in a material in Custom Points. So we have a really nice brochure that is catered to the veterans, and it kind of gives them a comparison on who covers what. So you see the first column there, benefits with VA only. Then you see the benefits with original Medicare. You see the benefits with TRICARE for Life, Cigna's Courage plan, and the preferred savings plan. So this is an amazing comparison chart. I will go ahead and send this also in my follow-up email, but I want to let you know that this is going to be it's actually getting refreshed at the moment, but it is going to be available for you to order in Custom Point. So if you have any sales events where you're going and it's catered a little bit more to the VAs, or you're currently doing a lot of work with the VAs, this is going to be perfect because it's going to be a simple way for you to just share the different coverages that are available through every one of these health plans or VA benefits or original Medicare as well. All right, so what else does Cigna do for veterans? We care for veterans. We really do. We have a lot of, we have a focus group that is focused just on how to serve veterans. We do have a 24/7 veteran support line, and the phone number is here on the screen. Also, there are flyers that you can print out, customized flyers with your information and the veteran support line phone number in case you want to share that. Our mindfulness meditation for veterans initiative provides training in stress management. And we have health plan options. So we understand that not every veteran is the same. Situations are different, just like with our regular original Medicare beneficiaries. So we do provide them MA options and MAPD options. I touched on this special election period last week, but I want to touch on it again and be a little bit more detailed about how to use the other credible drug coverage SEP. So CMS does allow for a special election period for those individuals who have other creditable drug coverage. So if a person has VA, for example, or TRICARE for Life, that is credible drug coverage. So they are able to switch from an MAPD plan to an MA only plan, or back to original Medicare if they wish. To qualify, the customer must meet all conditions below. So they must currently be enrolled in an MAPD or a PDP plan, something that covers prescription. Basically, that's the key. Receives or will receive other credible drug coverage, such as VA healthcare, TRICARE for Life, tribal benefits, to name a few. Wants to enroll in an MA only plan, like our Cigna Coverage plan, or is going back to original Medicare while maintaining other credible drug coverage. So they have to be keeping the VA, but just going into an MA only plan. And if they have never used this SEP before. So this is one of those SEPs that is actually valid just once in a lifetime. How to enroll a customer with this SEP. So first of all, ensure that the member meets all the criteria that I just mentioned. And secondly, the code is available on either, whether you do the application online or in paper, it's the CDC. So CDC is the code. And as you can see here, I took a screenshot of what the application looks like. So it has the code CDC, and then it says, I'm in a Part D plan, PDP or MAPD, and wish to enroll in or maintain other credible drug coverage and enroll in an MA only plan. So this is another option for you to think about in case you run into those veterans. Like I mentioned, a lot of brokers make veterans their niche. And so if that is your niche, this is something important that you need to have as an option. Available in Custom Point. As I mentioned before, we really do focus on veterans. We have a toolkit available in Custom Point designed for you to market to them. So there are postcards, there are posters. Apart from this, the comparison guide is being refreshed. There's also an educational brochure for veterans. So a lot of information, a lot of resources that you have available at the tip of your fingers at no cost. If you need them printed, get with me, get with Carla. As I mentioned last week, Daisy's already on maternity leave, but either Carla or myself can help you in ordering this material so that you're ready for your next VA sales event. Again, I cannot stress enough, let's use our resources. We already have a team that already came up with these strategies. Why not just put your name on it? So definitely make sure that if you're not using Custom Point, you take a look. There's not only veteran information or marketing material in there, there's turning 65, there's for duals. So very, very important for you to use your resources. All right, so with that said, we are at 10:24. We do have a little bit of time for questions. I do have a 10:30 training in Spanish. If you want to join us again, join again. If not, I hope all of you have a very good weekend. Celebrate your moms a lot. They deserve it. And I'm going to open my questions here to see if we have anything pending. Let's see. Okay, so a veteran with TRICARE for Life would be better off with the preferred savings plan. That is incorrect. A veteran with TRICARE for Life would be better off in an MA only plan, which is our Courage plan. Question, what if VA doctor prescribes a drug and TRICARE denies the prescription? Can MA pick it up and cover the cost? So in order for the Medicare Advantage plan to pick up the prescription, a network doctor would have to prescribe it to him. So he would have to go to one of our network doctors, get the prescription, and go to a retail pharmacy in our network to get that medication covered. But yes, it's doable. One of my veteran clients asked if Cigna provides a case manager or is it just a support line? So it is just a support line. However, if your member has other chronic conditions, we do have case managers available depending on the chronic condition that they have. That's a great question, Sarah. Thank you. And if I miss any, please unmute yourself. Let me know. Okay. So I have a client that has VA benefits, Part A, Cigna PDP, and Medicaid. He's interested on getting MAPD plan. He is 69 and has only had Part A. He is 69 and has only had Part A. Will he have to pay the penalty for not having Part B, or are VA benefits considered sufficient coverage? So VA does have credible coverage. However, even for VA benefits, they must enroll in Part B. So that right there tells me that they probably don't have VA healthcare yet. However, this person has Medicaid. So I would encourage this specific client to apply for Part B. Medicaid will pick up the premium, and they also pay for the penalty. So because they have Medicaid, that's really their savings grace in this situation. And then once they get Medicaid, I would definitely and apply for Part B, I would definitely apply for VA healthcare benefits. And if they want an MAPD plan, I would go for the total care, not the courage or the preferred savings. And Mark, we can talk a little bit more. I know I said that really fast and there's so many components to it. So if you want to talk about that a little bit more, give me a call. Let's see. If they have Medicaid, they will be pardoned the penalty. Okay, thank you, Marco. Yes. Which plan is for MA only, but they are not on TRICARE? So MA only is going to be the Courage plan. And if they're not on TRICARE, they have an option to either go with the Courage plan or the MAPD, the preferred savings, and both of them will give them the Part B premium. And I think that is all of our questions, and we have 2 more minutes. So if I missed a question, please unmute yourself and let me know. If not, type it in real quick. We got a couple minutes. So I'm gonna wait here. Awesome. I'm getting a lot of thank yous, which tells me that you're probably, all your questions were answered. Great. Okay, thank you, Sarah. All right, awesome. So I think that about does our time here. Okay, I have one more question, Mr. Alanis. So whether TRICARE, they can choose a plan. Yes, the main point here is that no matter what veteran assistance or benefits they have, they can enroll into a Medicare Advantage plan. Thank you, Mr. Alanis, because that pretty much summarizes all the information that I just provided. And with that said, again, happy Mother's Day to all of our mothers here that joined. I hope you all have an amazing weekend, and I'm going to give you all 1 minute back. You all have a great weekend.